of Haruv from the couch. Thousands of people have participated and viewed your offerings already. And from the Parent-Child Center of Tulsa, we thank you for what you're doing there at Haruv USA. And Paul, it's great to see you from Israel. Thank you for your investment as well. Esther, it's great to see you too. Thank you, colleagues. I see a number of colleagues here from the Tulsa area as well, from Parent-Child, from Tulsa Public Schools, etc. Also, I'd like to give a shout out to my wife who's on the line too, Gail Hahn. So she is a teacher at Tulsa Tech here in the area, and we'll be celebrating our 20th anniversary on May 20th. And so I have to say that, you know, in this forum. So thank you. So that's something I just wanted to say. So today, let me put my presentation up, and this is available as well after the presentation. All right, excited to share today bullying prevention and socio-ecological perspective. My contact information is there. This slide will be up at the end as well. If you have any questions or would like to further this discussion, I would be happy to do that. Here's a little bit about me. Master of Science from OSU, degree in education, theology degree from ORU here in Tulsa as well. I've been at the Parent-Child Center for a number of years. I've been in the field of bullying prevention for about 2 decades now. Also have a number of volunteer roles that I have in the community with Oklahoma PTA, and I coach U16 girls soccer, so that I should get an award of some kind for working with teens in that capacity, especially coaching soccer. So just an overview of the presentation today. Essentially, bullying prevention and intervention is just not a school activity. It should be a community activity as well, from individuals to families to businesses, faith-based organizations, etc., and also society as a whole. So this presentation will focus on the work of the AntiBullying Collaboration, which is a program of the Parent-Child Center of Tulsa, and our work in the field of bullying prevention in northeastern Oklahoma. So where I want to start, though, is a most important place. It's the definition of bullying. And there are many definitions out there. Our state has a definition in statute. The CDC has a definition. But I also want to bring along the SAMHSA's concept of trauma as well. Over the years, this has been a sticking point for students, for parents, for school administrators, for educators, just the notion of what bullying is and how we should move forward with this concept or construct of bullying and who's right. And I think that's a huge question that we're trying to answer today. But along the lines of viewing bullying through a trauma-informed lens is really what I want to get at the beginning of the presentation today. Here's SAMHSA's concept of trauma on the left, you know, has lasting adverse effects on the individual's functioning. Events and circumstances may occur as a single occurrence or repeatedly over time. The individual experience of these events or circumstances help to determine whether it's a traumatic event. Particular event may be experienced as traumatic for one individual, but not for another. Traumatic events by their very nature set up a power differential where one entity has power over another. You know, think about your own experiences growing up in school or other youth activities you were involved with, and this idea or this concept of bullying happened to you. Perhaps you were a victim. Perhaps you saw it happen as a bystander. What do you remember? I mean, if you were victimized, if you were in that role, a lot of us can bring those experiences forward in the very present tense. We remember, you know, how we felt. We remember the stress of the situation. We remember how people looked at us in those times. So no matter if it was a repeated event or a one-time event, it was traumatic. And so this notion of trauma and bullying is really the lens that we look at bullying at. Bullying is peer-to-peer abuse. It is traumatic. And the notion of repetitiveness or one-time events is really what we grapple with as a state and as our school districts move forward with policy as well. And I'll show you what I mean by that in a minute. But the CDC's definition of bullying as well is trauma-informed to an extent. So you see any unwanted aggressive behaviors by another group of youths or who are not siblings or current dating partners. So this notion of horseplay, comes into effect there. This is unwanted aggressive behavior. Kids aren't playing around. There is an imbalance of power, as you'll see in the next bullet point there, whether that's observed or perceived in the situation. It's repeated multiple times or is highly likely to be repeated. Bullying may inflict harm or distress on the target of youth, including physical, psychological, social, or educational harm. So when you look at the definition of SAMHSA's concept of trauma and the CDC's definition of bullying, you have a lot of similarities here. You have harm, you have single incidences or repeated incidences that could be considered bullying or trauma. But this is really how I wanted to set the pace today, is that the notion of bullying carries trauma with it. It's peer-to-peer abuse. And that could be new thinking for folks as well on the call, that bullying is abuse. This behavior is harmful to students on a peer-to-peer level. Now let's take a look at our state definition of bullying. And this is pulled from statute, as you can see. Bullying means any pattern of harassment, intimidation, threatening behavior, physical acts, verbal or electronic communication, etc. So in the state of Oklahoma, you have to have a pattern when it comes to bullying. And that's really a weakness that we have in our own statute right now in Oklahoma. So you have to establish this pattern. Students have to present or an investigator has to find that this type of behavior has happened repeatedly to a student or group of students for it to be coded as bullying. If not, it might be coded as a conflict, or not coded, but just simply labeled as a conflict, or even coded as a fight later on. And further, just so you can see that our schools are required to investigate bullying, you can see in our statute that policy must name an individual to investigate bullying. They must document and verify that bullying has occurred, and also the parents of the perpetrator or the person who's being abused must be notified after the fact. And so this is all information that happens afterward when a bullying investigation has been conducted. And if you want to really keep it to the letter of the law, after it's been verified and documented. So if a bullying investigation moves forward and they do not find bullying, according to our statute, the parents do not have to be contacted regarding the outcome or even that a report has been filed. So the way I see it is Oklahoma has some definition issues. The first one, bullying is not limited to a single incident, but must be repetitive behavior. It's common for students to have to endure being bullied until a threshold of pattern has been met, after which intervention strategies are initiated. And on more than one occasion, I've heard, students and parents and others tell me that it has to be measured by 3. It has to happen 3 times before an intervention strategy can be moved forward regarding intervention and prevention methods. And so a child has to endure that behavior in many instances. There's no provision for power imbalances as well. A person is either a bully or a victim in Oklahoma's definition. Dan Oveus, who is really kind of the father of bullying prevention from Norway, he has the bully victim concept, where a person can be both bully and victim or victim and bully, but within our state statute, you have to be one or the other. And so it makes it interesting for interventions. Next, they're under 2. If a victim chooses to behave aggressively, physically or verbally toward the bully, it is likely to be coded as a fight, even if the target has less power and has no real control over the outcome of the situation. So the moment that you show some type of aggression toward a person who is picking on you or bullying you or abusing you, even if the power that you have is less likely to determine a positive outcome for you, it's likely that that might be coded as a fight. It might not be looked at as a bullying situation because we have no provision for power imbalances. And lastly, our definition is not trauma informed in the state of Oklahoma because the person who is victimized, if they have this idea that they have been bullied, ultimately it's up to someone else to investigate that and to make that determination. Now, I'm all for schools investigating and setting a course of intervention and prevention strategies. Being in this field for 20 years, this whole word bullying has been such a problematic notion because these definitions are so narrow, and our legislation, really kind of pigeonholes this into a particular definition. So it's either is or it isn't. So sometimes I wonder if we just get rid of this word altogether and talk about trauma and intervention and prevention strategies when it comes to bullying and peer-to-peer abuse or school-based trauma, how much more progress we could have regarding, the safety and well-being of our students while at school. So those are the definition issues as I see it. Here's some recommendations regarding policy and practice. So align our state definition with the CDC's definition of bullying to include single incidences that are highly likely to be repeated. Now with this, because of our state statute, that administrator at school would still be the person who would determine if bullying actually happened. So that still gives power to schools to make that decision. Also include power imbalances, the attempt by the perpetrator to exert control over the target youth's behavior or to limit the victim's ability to respond or stop their aggression. Now, this is specifically from the CDC as well. And as you can see, the practice recommendations there. Under number 1, understand bullying via a trauma-informed lens, understand the short-term and long-term outcomes that are similar to ACEs. Now, I don't have time in this presentation to go into that, but there's a body of research out there that shows that the outcomes are similar regarding stress, prolonged stress, and health outcomes related to bullying as well. We are well versed in the short-term outcomes related to victimization regarding academic progress, depression, anxiety, mental health issues, etc. But those long-term outcomes more, that's a whole, it can be a new body of research that's available, but that are similar to ACEs. And I have that at the end of the presentation just as a sample. The individual determines if the event is traumatic, not the investigator. One person may experience trauma while another may not in similar experiences. This is always that dual role of how come you can't behave like someone else? Someone else has had the same experience. It made them tougher, that toughened them up. How come you can't be like that other kid? But you know what? Not everybody experiences trauma in the same way. Not everybody has the same resiliency. Not everybody has the same problem-solving skills in those situations. Also, the last bullet point there, parents will experience trauma alongside their children during bullying or other school-based incidents associated with violence or abuse. And, what Gall mentioned earlier, we do have a partnership with Haruv USA regarding a social simulation there at OU Tulsa regarding bullying investigations, where we have administrators and educators who investigate incidents of bullying. They sit through 2 lectures. One is based that I give on bullying as trauma, and another one is on adverse childhood experiences. So that's the first part of the day. But the second part of the day is working with actors in pre-written scenarios regarding, bullying at school. And often there's a parent actor with a teen actor as well. And I know administrators and counselors on this call and others can tell you that, when parents arrive at school, they're angry. They are not thinking clearly at times because they're responding to the stress of a traumatic situation. So we know that parents are experiencing trauma as well, and they just want their child to be safe, but oftentimes those discussions don't move forward very cordially. So these are the policy and practice recommendations, and we'll talk about what we're doing to move those forward here in Oklahoma in just a bit as well. I did want to give you some data. I know a lot of you on the call are familiar with the Oklahoma Youth Risk Behavior Survey. I saw Tosin Akonde earlier. It's great to see you, who's with the Department of Ed and who used to be with the Department of Health. But this data on the left side of your screen shows data from 2013 to 2017. Youth Risk Behavior Survey is done every other year via random selection of school sites with high school students grade 9 through 12. And according to high schoolers in the state of Oklahoma, between 13 and 17, you've seen a significant increase of students who believe they've been bullied while at school at least once in the past 30 days. So this is totally student perception in what's happening. On the right side, you see data from the Department of Education, the annual school incidence report. Every school district in the state of Oklahoma is required to report up to the Department of Education regarding bullying, bullying without physical injury, bullying with physical injury, fights with physical injury, without physical injury, and just a myriad of other behavioral elements of violence while at school perpetrated youth to youth. So even aggravated assault is contained within this annual report. But you'll notice regarding the same time period that you see a decrease in bullying, verified and documented. I'll use those terms, verified and documented incidents of bullying while at school. So in 13-14, 1,089, in 17-18, 866. And so the data clearly shows a gap. There are all types of reasons for this. When you think about high schoolers, are they reaching out for help to their teachers and administrators, or are they just moving forward and taking the abuse because of the many messages that we teach our kids in society today? Toughen up. This is just a part of adolescence and development. I was bullied when I was a kid and I survived. Those sorts of messages that just really do not help. Perhaps these students have reached out for help before, and the type of help that they've received was inadequate. And so with each time they reach out, the likelihood that they reach out again because of an inadequate response really kind of is a barrier for them to asking for help subsequently. And so this is data that I like to point out regarding Oklahoma and what our youth are saying and what our schools have found. But even a report on the Department of Ed site, you can find that information under school performance. Before I used to have to submit an open records request, but now it's all there so anyone can see it. I did want to show a little bit more trend data from Oklahoma just to get it out there regarding violence as well. The first one is pretty important here. Percentage of students who did not go to school on one or more days because they felt they would be unsafe at or on the way to school. It's significantly increased from 2009 to 19. Also, there's some sexual behavior there as well. Even rape is included. So this is the type of information that I look at all the time for 2 decades rather. And so it's kind of the fuel that moves me forward in the work of intervention and prevention. And then under bullying as well, you can see in 2009 and then 2019, you have a significant increase from 17.5% to 19.4%. Also electronic bullying as well. We see that, we're at about 14.5% in this area. Even the mental health piece, though, in this time where we're focused on, hope-informed strategies with the work of Dr. Chan Hillman and what he's done in our state and across the nation, this is exceedingly important. Percentage of students who ever felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some usual activities. So when I see 38.6%, that's just a percentage, but I see tens of thousands of kids, of students in our state who said, you know what, I've had this sadness or hopelessness to such a degree that I'm stopping doing the normal things that I do. And we really need to take, note of this, and this should inform our practices as well, how we work with students. And also percentage of students who seriously considered attempting suicide. You can see that the number has significantly increased from 2009 to 2019. So that kind of sets the stage for the definition of bullying, looking at bullying via trauma-informed lens, understanding that this is peer-to-peer abuse, looking at the state of Oklahoma's definition, knowing that there is no room for single incidences that are highly likely to be repeated. There's no talk of power imbalances, et cetera, regarding the bully victim dynamic. This sets the stage. So now what I want to get into is the portion regarding the anti-bullying collaboration in our socio-ecological model that we've been following since 2012, SAMHSA's theory of practice. Many of you are aware of our work and have been part of our work since 2012, and have even been during our 2012 conference call or press release to announce the collaboration. We're part of that as well. But our mission is to promote a safe, civil, and respectful community by preventing bullying among children, youth, and adults. And I'll tell you right now, we've really keyed into the children and youth part. The adults has become more elusive because our work is really keyed in with the community in that socio-ecological model regarding, parents and teachers and students. We've had some great philanthropic support. The Charles and Lynn Schusterman Family Foundation has been with us from the beginning. Our great friend and partner, Randy Cherney, as well, has been part of the work. And definitely without the support of the Charles and Lynn Schusterman Family Foundation, we would not be where we are today. Also the Ann and Henry Zare Foundation and the Sanford and Irene Bernstein Foundation. Our past philanthropic supporters include the Tulsa Area United Way, through their community investments initiative, and the George Kaiser Family Foundation. You can see our 25 cross-sector partners there, cover a wide range of community partners. A lot of them are education-based, from local districts here in Tulsa County to prevention agencies as well, the health department, Oklahomans for Equality, the PTA, et cetera, just to list a few. But we've had a great partnership base. We meet once a month here at the Parent-Child Center. So more about that in just a little bit. Here is our motivation for being drawn together or for convening in 2012, the documentary Bully. Perhaps you've watched that documentary by Lee Hirsch. If you haven't, I really encourage you to do that, because it is really a vivid look at bullying and youth in the United States, and more interestingly in Oklahoma. Before this film was set to release, I knew at the time that 2 of the families of the 5 in the film were from Oklahoma. So you have Laura and Kirk Smalley, who've become great friends to me, Kelby Johnson as well. Those 2, those 3 folks were from Oklahoma before the movie was set to release. However, the Libbies also moved to Oklahoma. They're from Sioux City, Iowa, and they moved here to be closer to the Smalleys. So in essence, 3 of the 5 families being from Oklahoma really was the convening power here, just to have that conversation with community stakeholders. This film's getting ready to release. What does that say about Oklahoma? What does that say about our prevention strategies that we've, been utilizing all of these years? What can we do to move succinctly throughout the state to provide better, prevention and intervention policy, et cetera? So that's really the launching point. And also, thankfully, the Schusterman Family Foundation did bring the director of the film, Lee Hirsch, in as well in June, and we had a special viewing at Circle Cinema. The mayor was there. We had a panel. The Libbies were there as well. And it also was subsequently viewed with Teach for America teachers too. So that was really the convening power behind the anti-bullying collaboration and moving forward. We had some significant milestones in the beginning as well. So we announced our formal initiative as a collective impact initiative on August 10th, 2012. We've had some great support from our local media too. Many of you remember Russ McCaskey, who was here for a number of years with Channel 2. We partnered right away, and we had a 30-minute primetime live special in the fall of 2012 regarding bullying prevention and intervention. And those folks there on the panel were Russ is. They were from TPS administrators. We have a community activist there, and we have a local therapist. But we had a number of therapists that were answering calls from the community during that live event. We advocated for House Bill 1661 as well, wrote language for that bill. Ultimately, it was a mandatory annual training for school staff regarding bullying prevention and intervention practices. And we worked with the Department of Education to develop that training during the summer of 2013. We had a kickoff with the Department of Ed, and we actually did a training in 5 regions in Oklahoma, and we did a webinar as well that lived on the department's website for a couple of years. So those were our significant milestones as we moved forward with the work of the collaboration. Now getting into this SAMHSA socio-ecological model. I know a lot of you are familiar with this already, but really the notion that bullying or this type of behavior does not exist in a vacuum is really where we're launching from here now. There are many involved: the individual, their relationships, the community, and societal influences are all operating and influenced by each level as well, and supported or not supported to a large degree by this model. So breaking into it a little deeper here, bullying prevention and intervention should be addressed at all levels. So with the individual, you know, we'll get into it here in just a minute. Let me take a look at the time. Okay, we're good. Just the notion of an inability to relieve stress and having a bad day. I mean, something as obvious and simple, but as complex as that, you know, often is the point at which people mistreat others. I mean, think about the last time you had a really stressful day. You know, how did you treat those closest to you? How did you treat your coworkers? You know, did you recognize that you were possibly mistreating those around you? And what was your response after you were, you know, either confronted or realized that, hey, I may have mistreated a loved one or a colleague or someone in the community? How did you move forward with that? So this whole notion of the individual, you know, speaks volumes. In relationships, you know, when I think about bullying prevention strategies and intervention strategies, you know, you have to think about the family core. You know, what is the belief about bullying and how we treat others? You know, working with families and students in schools for 20 years, you see a lot of different family norms about how you move forward with responding to, you know, violence, with bullying. And, you know, personally, growing up in a family where you didn't take that sort of thing, I remember, you know, seeing just many incidences where, you know, even as kids, we were encouraged to go to the next step, you know, fight and do that sort of thing if somebody picks on you. But, you know, so many families live in that space and that's their norm. Well, hey, you don't let people pick on you. You're going to go and take care of this and come home, and that's how we do it. So the notion of family and community, etc. So I'm going to move forward through here kind of quickly so I can share how we've moved forward as an anti-bullying collaboration to address these areas. So here's really what our model looks like. So at the societal level, we've had a lot of hand in policy development at the state and local level as well. We've had a strong TV media presence here in Tulsa. We're blessed with that. We have 25 cross-sector partners. We meet once per month. You can visit our website at preventbullyingtulsa.org. We regularly have conferences, workshops, and also we partner with different athletic events. Tulsa Drillers has been great here for a number of years. We've partnered with those folks to do an anti-bullying day at One Oak, alongside with Tulsa Health Department and our partners as well. Lots of professional development, parent education, social emotional learning, and bullying prevention programming. So obviously, with the community portion, a lot of our partnership is with schools and parent groups and other nonprofits here in Tulsa. It's easily convened. Also on the relationship level, we've worked hard to really convey to this notion of social emotional learning, competency building for students and adults, and more recently brain-based interventions, based on great researchers and scientists like Dr. Bruce Perry and others. Also on that individual level, fostering one-on-one relationships based on empathy and support. We also provided quite a bit of technical assistance to, not legal advice though, I have to say that, for individuals seeking help in reporting and what the next steps are. So that's kind of what our model looks like. And so I'll move through and share about some of those things that we have going on right now. We're still in this space of advocacy, legislative advocacy. I know it's been a difficult session, as we all know. Currently, the discussion has been on the budget in Oklahoma and getting past our downfall here with appropriations. But we have moved a bill forward out of the Senate, and it's in the House right now. And we're working to get this bill heard before this session ends, even during this time right now when things are closing fast. So here's what we've been working with Senator Sharp and Representative Kerb in the House, and it's in the House, like I said. So we'd like to see our definition change and align with that of the CDC. So instead of bullying means any pattern, we'd like to see that scratched and aligning with the CDC. Bullying means any unwanted aggressive behavior committed in person or by electronic communication, etc., that involves a power imbalance and is repeated or is highly likely to be repeated. That way we have this notion of single incidences that could be considered bullying, and also that power imbalance where truly one person has more power than the other to control the outcome and to limit, the victim's ability to get help for themselves. Next, there's an important piece about parent notification, requirement for notification to the parents or legal guardians of the reported victim of bullying and the parents or legal guardian of the reported perpetrator of bullying within 24 hours of the recipient of the report of bullying. So this notion of having parent notification before the investigation starts. There's a report of bullying. Now as an administrator, I'm required to notify both sets of parents or guardians to let them know what's going on, and not after the fact. And this is a fairly quick turnaround within 24 hours. Also, here's another piece too. If a student expresses suicidal thoughts or intentions or encourages another student to commit suicide, the parents or legal guardians of the student shall be notified immediately. So, and when we're thinking especially about distance learning as well, and district-owned devices, and how, what type of monitoring software that districts are using regarding Chromebooks, etc. This would speak to that. Or even if a student did a search online regarding, suicide or harming themselves, or even threatening another student. So that applies to virtual space or digital space, but it also applies to face-to-face as well. I'm just thinking back to the data from the Youth Risk Behavior Survey regarding those students who would consider suicide. This is fitting for parent notification. So that is our current focus, legislative focus. Also, we really maintain a positive connection with the media at this point too, and have for a year since 2012. You'll see that we've worked with KJRH Channel 2 and Channel 8 regarding cyberbullying and cyber safety during distance learning. And the main concern here is that, as you know, students are at home, possibly with more unsupervised time online. So they possibly are exploring more, interacting with other students, friends, people they know, perhaps people they do not know as well. And so we're looking for a possible increase in cyberbullying and a possible increase in safety issues regarding interacting with the unknown other, is what we call that. This is an important piece too, regarding parent supervision. As a parent of high schoolers, I remember when our kids were younger, it was really easy and tempting just to hand them a device to, just as a distraction, as something to do. But really, it's one of the most powerful tools we could give our children. And so what's on our device? What's on our phone? What's our social media look like? What can they actually access with that? So we're really kind of advising parents at this point too, to create those family and social norms regarding what their children can and cannot access online during this time. It's a great point. I was asked by Keith Taylor there at the bottom center, when should parents start having these conversations, about family norms and expectations regarding cyberspace? And I said, as soon as you hand them a device that can get them online. If you're putting that device in the hand of your child, you should have norms and practices as a family already discussed and already in place once that device is in that child's hand. We did have a great partnership as well with Channel 8 and our Bullying Is Not Okay. Bullying Is Not Okay campaign 2 years ago, and that still lives on their website as well. There's a number of videos there that can be viewed or downloaded, and so it was a great. And I just have Lori Fulbright up there because she's talked about us a few times. So moving forward as well, and as mentioned earlier too, regarding school-owned devices and distance learning, if there's an increased risk of cyberbullying and cyber safety issues due to students spending more time online, perhaps unsupervised, schools are likely responsible for intervention in when cyberbullying happens via a district-owned device. And I have the word likely there too, because we're in a real gray area, I feel, right now. If it's during a class, if it is during a Zoom call with a group of students, or even a small chat, and cyberbullying happens there, or something that compromises safety, obviously, yeah, absolutely. But if a student is using that device on their own time, in their room, unsupervised, what is the responsibility of the school in that situation? I think it's a gray area. But I would say that schools are likely responsible. However, I think a lot of our districts who do have one-to-one capacity among students are responsible, and they have monitoring software such as GoGuardian and Beacon, or securely to monitor student online activity. Beacon is a product of GoGuardian, and that particularly is used regarding suicide prevention. And so I would ask, if you're involved with the school, what type of software, if you have monitoring software for your one-to-one devices. And even as a parent, I would have that conversation too regarding, cyber safety and digitally owned devices and student activity online and what you can expect. I know as a parent, we get reports every week regarding our children's online behavior, sites that they've gone to, if there's been any restrictions, et cetera. So we have access to that information. So next, I do want to focus here just for a minute on our website as well, preventbullyingtulsa.org, and I do want to key in on our educators link for just a second. If our partners have any type of prevention programming, bullying prevention, violence prevention, etc., you can access their programs from this link or under the educators tab, and that will take you directly to the program resource that the partner offers. And oftentimes these are services and programs that cost nothing to schools, individuals, et cetera. So I do want to highlight that as well. And also just the idea toward the bottom center, the resources from the Department of Education. They really have developed a great panel of resources there, especially regarding reporting. what parents can do, what administrators and teachers can do regarding documentation, documenting those incidents of alleged bullying. And so I always encourage folks, go to the Department of Ed's website, go to our website, look for the forms, because those forms are really important. I've heard on a number of occasions when parents seek transfers from one district to another, that if a district cannot provide the documentation to a potential transferring district, it's the transferring district, and they do not have to accept that transfer request. And so it's exceedingly important that things are documented well. And like I said, the Department of Ed has a great number of forms for anyone to use. Also, here's our reporting site as well, our tab rather. You can see that our partner schools there can click, an individual can click right to their link and take them to the reporting page. Here's Broken Arrows, for instance, but we have Broken Arrow, Jinx, Tulsa, Union, etc. We also have an Oklahoma Security Institute tip line report as well. And this is a reporting feature for any school in the state of Oklahoma. So a parent, a student, a teacher, anyone can make a report there regarding bullying, gang violence, suicidal behavior. It's also important to know that this is a department of the Office of Oklahoma Homeland Security as well. Lastly, we have the Office for Civil Rights report link. And again, we're limited on time, but when bullying and civil rights become an issue, it behooves districts and schools to, as you know, to create a plan to address the issue. It's not just enough if it's a civil rights issue to address the issue under the school's anti-bullying policy. There are specific requirements from the OCR that you're looking to demonstrate if you are a school site or district, to demonstrate that you have worked to prevent and intervene in those situations. And here are the titles that you need to be aware of: Title VI, Title IX, and Title II regarding these protected areas. So often when I speak with students and parents, the discussion is, well, do you believe that these types of incidents are based on any of these title pieces: race, sex, disability, etc.? And if they are, it really calls for a different type of reporting mechanism, which is here at the office, U.S. Department of Education. So real quick, here's our community focus highlight. We do some notable conferences as well. We've had Mark Brackett in twice from Yale Center for Emotional Intelligence, Dr. Tracy Viancourt as well, University of Ottawa. Her research, Bullying Gets Under Your Skin, is worth the read, and really is associated with those ACEs and the life course type of outcomes. Gary Ruddick, who a lot of us know regarding his police work here in Tulsa Public Schools and other parts of the community, is now with the Oklahoma School Security Institute, is Protecting Our Future regarding school shootings. We've had that a number of times. Chris Harris Jr., who used to be a Denver Broncos, one of my favorites. You can see that's the large picture with 200 youth that we have worked with regarding bullying prevention for years in the past, and our anti-bullying day at the Drillers. These things will move forward as well this fall. We'll be working this summer to bring professional development forward for teachers and parents, so be on the lookout for that. This is something we do regularly. And also, just to talk about our current relational individual focus highlights, a lot of us are familiar with Dr. Perry's 3 R's, reaching the learning brain, and the notion of top up versus bottom down. You have this idea that individuals under stress, really students under stress, prolonged stress, toxic stress, students who are having some sort of crisis in the classroom, what is our best approach? Is it to reason with them first, regulate, relate or regulate, or is it to regulate, relate, or reason? So think about the idea of you're in a stressful situation, you're driving to work, you're late for a presentation, you're in a traffic jam on the highway in the Tulsa area, it's the Broken Arrow Expressway, and you are just really amped up and nothing's going right, traffic is going slow, and think about in that scenario having your junior math teacher pop into your head and try to teach you new equations. I mean, this idea that learning doesn't happen in stressful, high stress situations is really where Dr. Bruce Perry is coming from. And I think we've seen that in motion. So the notion that you move up from the bottom up to regulate, relate, reason is how you work with children and adults moving forward. And then the idea many of us are familiar with is the Castle model on SEL, the notion of self-awareness, social self-management, social awareness, relationship skills building, and responsible decision making. These are the skills that we're moving forward with right now regarding really what we do in education, with parents, with teachers, with students, really to address that need to relieve stress and regulate emotions. So I know that I'm about out of time. It's 11:48, and so I did want to highlight a few of the programs that we offer as well at the Parent-Child Center. Safe Passage we've already talked about, but also Teach Kindness. I think I have a copyright issue, so my picture isn't coming up there. So that's another free program that we've partnered with a national outfit regarding a pre-K-8 curriculum regarding kindness. That is a 1-month challenge, and it does extend throughout the school year, but we've worked really vigorously here in Tulsa County to get that off the ground. Our Kids on the Block puppet program, which is offered at the Parent-Child Center for elementary age kids, has gone virtual, by the way. You can actually see those puppet shows online right now for those of you that are familiar, and of course our anti-bullying collaboration. So I will stop there, Goal, and I'll stop sharing the slide as well. And we can move into the next phase.
Thank you. Thank you, Steve, so much. We had one very important question at the beginning that Paula is going to read. And please, all of you, take a few moments. If you have any questions to Steve, this is the time.
Okay, there are actually questions. My first question is, where can you see the movie Bully? Because while you were talking, I looked it up on YouTube and they only have the trailers. There isn't the full movie.
I've seen it on eBay. I've seen it on Amazon. And so some of those, other internet providers, I think you could get it there.
Okay, thanks very much. The first question that we had was, I noticed that often when a kid reached out to a teacher, the answer was something like, well, we didn't see it, so I can't do anything about it.
Right.
Do you have any suggestions on how to approach a situation like that while staying professional?
Yeah, I think that's one thing that I commonly hear, and I've heard that for years now. And the idea in the state of Oklahoma is that when a child reports bullying, it's and this is going to be hard, it's not the teacher's job to verify or validate in the moment. They're to hand that off to the school official who investigates bullying, and so they can conduct the interview. But I can tell you there's a lot of fatigue around this idea, because a lot of students say, I'm being bullied, I'm being bullied, I'm being bullied. And so we know our kids. And so as an educator, perhaps you have that thought, well, no, you're not. This is really what's happening. And absolutely tell them, what your perception is about the situation, but also report it to that administrator who's responsible for conducting those investigations.
Okay, thank you for that. Another question, do you know what anti-bullying resources are available in the Oklahoma City area? This was awesome, thanks.
There is another group similar to the Anti-Bullying Collaboration, and it's actually convened by Oklahoma PTA, and they have a meeting once a month. The Department of Health is involved, the Department of Ed is involved as well, and other nonprofit groups. So I can get that information out. Heather Araya with the Department of Mental Health is the chair of that specific work group in Oklahoma City. But
what's her last name?
Heather Araya.
O-R.
It's, boy, I have to spell.
Never mind. I was going to write it in the chat, but.
Okay. I'll write it in the chat when we get done. How about that?
Thanks. Sorry about that.
Okay. Oh, I have it. A-R-I-Y-E-H.
From?
Pardon?
That seems like an Israeli name. Arieh. Yeah. From where?
She's from Oklahoma City.
PTA, you said?
Yes, yes. And also the Department of Mental Health. She's a preventionist at the Department of Mental Health.
Thank you. Does anybody else have any questions that they'd like to add? Yes. How do you suggest supporting a teacher or staff who is an advocate for a student who is being bullied, but the teacher is afraid of retaliation by the district due to them not acknowledging the bullying issue? Bullying can occur within school administration.
You know, that's a very complex question. In the current bill, Senate Bill 1133, there is language regarding retaliation in teachers and parents and students who make a report. And so I didn't get into that within the presentation, but I can certainly make that available as well as part of the PowerPoint resource. But that is an issue. I mean, and that's a real fear that if a teacher reports in some instances that there'll be some retaliation against that. I apologize if that's happening.
And I must say that these are the things that we are doing in our bullying training with the simulation. We are actually practicing different scenarios of situation that came from the field of kids that are complaining about bullying and then the educators have this opportunity to learn how to react and what to do. And it's also, we are doing this in small groups, so this is totally a supporting situation, and we can discuss all of these things, and we are when we are doing the feedbacks and everything. So I really recommend, I mean, when the corona will stop and we will go back to face-to-face meetings, I really encourage you, if you are educators from school and you need this, reach out to Steve or to Haruv, and we can definitely create trainings for specific school or for some teachers from different schools. It was a very, very good supportive and learning situation about this topic.
And with that specific training goal, thank you for saying that. Our scenarios, we've developed 4 different scenarios, and we've had those vetted by the Department of Ed here in Oklahoma as well. So we've had eyes on those, and they also have to do with civil rights violations as well, and what triggers are involved with that.
Okay, anybody else? Any other questions? There is a number of comments saying congratulations and happy anniversary to Steve and Gail. That is one of the things that is written on the chat.
Thank you.
Would anybody else like to ask, to open their microphone, to write something in the chat?
Okay, it seems like this is it. Paula, would you like to say about the CEU's information from Diane?
Yes, Diane will be sending you an email for an evaluation. Everybody will get that, and participants should email her if they need a certificate of attendance.
Steve,
that's what I was told to say.
Thank you, Steve. Thank you so much for this morning, and thanks the Parent-Child Center for this wonderful friendship. Thank you.
It's a pleasure.